I am Dr. Kumud Madan, Associate Professor in Lloyd Institute of Management and Technology, and I shall take up the second unit of your subject, Inorganic Pharmaceutical Chemistry, with the chapter number 2, that is Acid, Bases and Buffers. In my previous class, I had told about the importance of electrolyte and we had done the sodium cation. So, proceeding further, we shall study some other major and intra-extracellular electrolyte. The other electrolyte we need to study is potassium ion. This is also a cation and it is a major intracellular cation. As I told you, some of the ions, they are present either inside the cell, this is your intracellular fluid, and this is your extracellular fluid. So, potassium is the major intracellular ion or cation which is present in intracellular fluid. Its concentration is almost 23 times greater in the intracellular fluid as compared to the extracellular fluid. Means potassium is much higher inside the cell as compared to outside the cell. Potassium ion is responsible for the maintenance of the blood pressure and it also keeps the heart functioning properly. Besides that, it assists the nervous system by aiding in the correct function of tissues needed for using the nerve impulses. It also helps in the muscle contraction. Besides, it also promotes the efficient cognitive function by helping to deliver oxygen to the brain. It also maintains the electrolyte balance. So, could you see it has so important functions to play. Now, sometimes what happens, as I told you earlier, that there are the conditions which lead to the lesser or more concentration of these ions. If the potassium ion concentration decreases in the blood, the situation is called hypokalemia. When does this hypokalemia occurs? When does it happen? Right? So, hypokalemia occurs whenever there is vomiting, there is burns, there is hemorrhage, there is diabetic coma, or if IV infusion of solution lacking in potassium is administered, or overuse of thiazide diuretics. I told you earlier, diuretics are the agent which help in the promotion or the increased urination, which increases the output as well as the frequency of the urine, and thiazide is related to a chemical group. So, these are the kind of a diuretics. If overuse of these diuretics is done, it also lead to situation called hypokalemia. What does this hypokalemia do? If the potassium ion concentration decreases, what adverse effect it can lead to? Hypokalemia can cause the change in the myocardial function, flaccid and feeble muscles, and it also lead to the low blood pressure. The another state is, which is reverse of is, it is called hyperkalemia. Hyper means higher side. So, if the potassium ion concentration that is beyond the limit, that is more. So, this hyperkalemia occurs when there is a kidney damage. Hyperkalemia does what? It causes the heart muscle to become flaccid by displacing the calcium in the cardiac muscle and lead to possible cessation of the heart, that is the cardiac arrest. This is a figure which can show that the movement of the ions takes place. This figure is generally used when you study the generation of action potential in the muscle contraction. Here we can see this is the cell membrane. This is the cell membrane, right? This is the ECF, extracellular fluid. This is the intracellular fluid. I told you the concentration of potassium ion is 23 times greater than the ECF. So, in ECF there will be lot many potassium ions, but there are lesser potassium ion in the ECF. In ICF it is higher side. We can have a look here, potassium ion, potassium, potassium, potassium. See, you can see lot many potassium ions, and outside this is just one. and this is the exchange of the ions which takes place in the different body physiological functions. Another ion which we need to study is that is the calcium. Calcium is basically what? It is divalent. Calcium is an important constituent of bones and teeth, and the different food sources which provide calcium to our body, that includes milk and milk products and green leafy vegetables. Hypocalcemia is the condition when, again, hypo means lesser, when there is less calcium in your blood. This results from what? How does this arises? It results from hypoparathyroidism or vitamin D deficiency or bone cancer or hyperadrenal cortex and acute pancreatitis and acute hyperphosphatemia. These are the different conditions which are leading to hypocalcemia, irrespective that you are taking in the diet. You may have a belief that I am taking lot of milk and milk products and green leafy vegetables, or maybe dietary supplement rich in calcium, still my calcium level is lesser. Why? Because these pathological conditions lead to the less calcium. Say pancreatitis. Students, whenever the suffix itis come in the end, that is, it means inflammation. Always remember this. So, pancreatitis means inflammation of the pancreas, right? So, these are the different pathological conditions which can lead to hypocalcemia. Another ion we need to study, that is the anion, which is the chloride, right? Now, chloride is a major extracellular anion of both interstitial and vascular fluid compartment. It is obtained from the food. We take sodium chloride, that is your common salt, namak, which provides what? Which provides the chloride anion to us. Chloride is responsible to maintain cation anion balance in the extracellular fluid compartment. It is also maintaining the osmotic balance, and it is also maintaining the proper hydration of the cells. Besides, it is completely absorbed from the intestinal tract. It is removed from the blood by glomerular filtration and reabsorbed by the kidney tubules. Now, what are the other functions of the chloride? We have already studied that it is involved in the maintenance of the osmotic balance as well as the cell hydration. Besides, chloride generates the osmotic pressure of the body fluid, that is one and the same thing. It is an important constituent of the HCl, that is the hydrochloric acid. Hydrochloric acid exists in our stomach, which help in the digestion of the food. Since it is acid, that is why our stomach basically has the pH of 1.2. It is also used to maintain the body's acid-base balance, and it also helps to clear the waste product from the liver. Now, chloride deficiency, again when there is a lesser amount of the chloride, what it is going to lead to, or where does it arise from? किस वजह से होता है hypochloremia? ठीक है, it arises from diarrhea. Diarrhea, you know, it is basically a disease which can be viral or which can be due to eating of the contaminated food, which leads to the watery stools from the body. It's lead to what? It lead to like disbalance the electrolyte in the body. Then vomiting and sweating. These three conditions lead to the loss of the chloride ion from the body. Then chloride deficiency can further lead to metabolic alkalosis. Metabolic alkalosis means body fluids, they are shifting more to the alkaline pH or the basic pH. Then chronic pyelonephritis. I told you the meaning of the term chronic. Chronic means a disease which is occurring from a long time. Itis is the suffix which means inflammation, and pyelonephritis. Itis is inflammation, Neph is the inflammation of the nephron. Nephron कहाँ located होते हैं? Kidney में. Pyelo is due to bacteria. So pyelonephritis is what? It is a disease condition due to bacteria which leads to the inflammation of the kidney. And when this pyelonephritis occur, it is going to lead to the deficiency of the chloride as well. Other is the salt losing nephritis. Again, nephron and itis is inflammation, that is again the inflammation of the kidney. Then metabolic acidosis such as found in diabetes mellitus and renal failure causing either excessive production or diminished excretion of the acid. या तो एसिड बहुत ज़्यादा बन रहे हैं या एसिड एक्सक्रीट कम कर रहे हैं, कम हो रहे हैं, तो दोनों केसेस में एसिड जो है वो ज़्यादा है. ठीक है, अब एसिड ज़्यादा होगा, व्हाट इज इट इज़ गोइंग टू डू? इट इज़ गोइंग टू रिप्लेस द क्लोराइड इन द फॉर्म ऑफ एसिटोएसिटेट एंड फॉस्फेट, एंड दैट इज गोइंग टू लीड टू द chloride deficiency. This is also going to lead to the problems in the acid-base balance. Hyperchloremia, that is the state when the chloride ion are more than what they are required. That is beyond the limit. So hyperchloremia occurs from dehydration. We told you earlier that chloride ion is responsible for the maintenance of the hydration. Fine. So when there is dehydration, it is going to lead to what? Hyperchloremia. Then decreased renal blood flow found in the CHF, or that is cardiac heart failure, congestive heart failure, that also leads to the hyperchloremia. Severe renal damage, again the damage of the kidneys, that is also going to lead to the hyperchloremia. And excessive chloride intake, when you take more in the diet, that is obviously but linked to hyperchloremia. Now, there are the different concentrations of the cations and anions, that is the electrolyte, which need to be maintained in our body. And how is it maintained? That is maintained by the intake of these salts. So there is a recommended dietary intake which has to be taken. Say for example, recommended intake in milligram under 50 years of age, potassium is required in the concentration of 3400 milligram, that is 3.4 gram for men and 2.6 gram for women. And the same is the unit when even the person exceeds 50 years of age. There is no difference in the two. However, the sodium which is required in our diet is 1.5 gram per day, both for men and women. But if the age is beyond 50, the sodium content should be decreased. It should be taken not more than 1.3 gram or 1300 milligram. Then calcium is required up to 1 gram every day, whereas it is required more in women, that is 1.2 gram if the age exceeds 50. Magnesium is required in the concentration of 320 milligram in men and 420 in women, and the same is the case even if the age exceeds beyond 50. Chloride ion is required up to 2.3 gram or 2300 milligram if the age is below 50 years, and above 50 years it is required in comparatively lesser quantity, that is just 2 gram. So this is a recommended intake of the different electrolyte which should be followed in order to maintain the electrolyte balance in our body. Now, if in any condition, due to some pathological condition, due to some infection, due to the proper diet not taken being, we all leads to what? Electrolyte imbalance, and this imbalance is further leading to various diseases. An electrolyte disorder occurs when the level of electrolyte in the body is either too high or too low. Electrolyte need to be maintained in an even balance for your body to function properly. Otherwise, the body system will be affected, leading to many diseases. Now, what are the various symptoms? How do we know that electrolyte balance is not being maintained? It can be known by different symptoms which occur. The different symptoms of electrolyte imbalance are convulsions. Convulsion is what? Convulsion is involuntary body movement. Any movement which is not under control. एक sudden muscle contraction होता है, you shiver like, so that is something which is not in your conscious. So that is involuntary sudden movement of the body, that is the convulsions, daure padna. Then we have cramping. Cramping, you know, sometimes people say I am having cramp in my stomach. So that is again a spasmodic contraction of the muscles in the abdomen, which may lead to pain. So that is also one of the sign of the electrolyte imbalance. Then fast or irregular heartbeat. If your heartbeat is not regular or it is more than what is it actually is, so that is also symptom of the electrolyte imbalance. Then another symptom is fatigue. You just are always restless, you are having lesser energy to do the work. That is also one of the symptoms of electrolyte imbalance. Now these symptoms may be overlapping with other diseases. It does not mean whenever you are having a fatigue, you are having some electrolyte imbalance. It can be associated with other disease also, right? Then headache, muscle weakness, numbness and tingling. These are the features of the electrolyte imbalance. Another ion we can study is phosphate anion, which is given by the formula PO4 negative. It is a principal anion of the intracellular fluid compartment. Hexoses, that are sugars, they are generally metabolized as phosphate esters. Phosphate का जो सबसे important role है, that is it is a part of ATP. ATP is what? Adenosine triphosphate. और ATP क्या है हमारा? ATP हमारा energy unit है. हमारी body में कोई भी physiological function होता है, so always ATP is either made up or ATP is consumed. So phosphate is the component of phosphoric acid anhydride linkage in adenosine triphosphate, that is ATP. Phosphate is an important buffer system both biochemically as well as pharmaceutically. It is also involved in calcium metabolism. It is also essential for normal bone and tooth development, and it is component of hydroxyapatite. Now, the different conditions when the balance of the phosphate is not maintained in the body can be categorized either into hyperphosphatemia, hyper means higher side, or hypophosphatemia. Now, hyperphosphatemia occurs from hypervitaminosis D, यानी कि विटामिन डी जब बहुत ज़्यादा हो, that can lead to hyperphosphatemia. Another condition which can lead to hyperphosphatemia is renal failure. Renal failure due to inability to excrete phosphate into the urine. इसके अलावा besides this, hyperparathyroidism permits the renal tubular reabsorption of phosphate. What happens in this condition? Hypoparathyroidism, this permits what? Reabsorption को नहीं होने देता है, ठीक है, which results into decreased urinary phosphate and a rise in serum phosphate. Then let us study different conditions of hypophosphatemia. Hypophosphatemia कैसे होगा? When vitamin D deficiency is there, we did here, vitamin D ज़्यादा होगा, it can lead to hyperphosphatemia. Vitamin D lesser होगा, it can lead to hypophosphatemia. Then decreased intestinal calcium absorption, hyperparathyroidism, we studied here, hypoparathyroidism is leading to hyperphosphatemia, and hypoparathyroidism is leading to hyperphosphatemia, and hyperparathyroidism is leading to hypophosphatemia. Then long-term aluminum hydroxide gel antacid therapy. Therapy means some medication. Antacid means which is going to effective to be in the acidic state. Like people, they generally take antacid for the acid relieving. So if it is long-term, from a person has been taking the aluminum hydroxide gel, which is an example of antacid, from long, he is going to develop what? Hypophosphatemia. Now, the compounds which we need to study, or the substances we need to study as per our AKtU syllabus, they are sodium chloride. You know sodium chloride? That is common salt. कहाँ से आता है? Sea water से आता है. तो sea water में we know there is enough salt. We generally do what? We evaporate water and we get the salt and then we refine it. So this is a diagrammatic view here. When you heat the salt solution, water evaporates and we are left with the salt. This is a method of the preparation of the sodium chloride, quite easy method. Now, the different characteristics or the features of the sodium chloride. It is odorless, there is no odor, कोई महक नहीं होती है इसकी, colorless, कोई color नहीं है, white है, so it is odorless, colorless crystal and it is soluble in water. आपने देखा होगा पानी में NaCl नमक बहुत जल्दी घुल जाता है ना? So it is soluble in water as well as glycerol. However, solubility decreases with the HCl. When HCl hydrochloric acid add करते हैं तो इसकी solubility कम हो जाती है. Besides that, 0.9% NaCl. We did that when we studied that isotonic solutions के examples कौन से थे? 0.9% weight by volume of NaCl. Right. The solutions are sterilized by autoclaving or the filtration. Now, let us do the study of the sodium chloride assay. Assay is what? Assay is a technique in which you study how much sodium chloride compound exists. उसको आप quantify करते हो या फिर qualify करते हो कि उसके अंदर NaCl है कि नहीं है, ठीक है? तो हम इसका assay कैसे करते हैं sodium chloride का? Say any compound which is say X for us, in which we think there is sodium chloride, we are going to take that and we are going to treat it with the excess of silver nitrate. Now, this is silver nitrate, there are silver ions and nitrate ions. Now, when this X is treated with the Ag plus, it is going to lead to the formation of AgX, and whatever Ag has not reacted with X will be in excess. So, we have the excess of the chloride silver ions here. Now, this excess of chloride ion is treated with the standard solution of thiocyanate ion. This is HCN, thiocyanate, Cn negative SCN, and it is going to lead to the formation of this complex AgSCN. The first slight excess of thiocyanate ions give red color of ferrous thiocyanate, and this red color tells that the sodium chloride exists. So, sodium chloride assay is the procedure to determine how much sodium chloride exists in any compound or any salt. How it is done? We are going to take the substance, we are going to treat it with excess of silver nitrate. Silver nitrate contains silver ions. So, that compound is going to react with the silver ions forming the AgX, and excess is going to be remaining there. Now, this excess is treated with this thiocyanate using ferric as indicator, and this ferric thiocyanate finally of the red color indication tells that there is a sodium chloride. Now, what are the different uses? Why do we need sodium chloride? Sodium chloride is basically as electrolyte replenisher. Re means repeating. So, whenever there is deficiency of the electrolyte in the body, sodium chloride comes into play and helps. Sodium chloride is also an emetic. Emetic is some agent or compound which helps in emesis or the vomiting out. Generally, what happens if there is a poisoning, maybe it is intentional or unintentional, then we need to help the patient by not absorbing that poison. So, what do? We ingest vomiting in that patient so that he expels all the poison which he has taken and which is still in the mouth or the upper GIT. So, we give what? We give emetic for the vomiting purpose. Besides this, sodium chloride is topical anti-inflammatory agent. It is helpful in the removing of the inflammation. It is also used in the treatment of extracellular volume depletion. It is also as an irrigating solution in the case of the eye drops. We need to wash the eye drop before surgery. So, sodium chloride is an agent of the irritating agent. It is also used in the nasal drop as well as the mouth washes. Now, some of the official sodium chloride preparations which are mentioned in the official literature, pharmacopoeia, or which are also available in the market, they include sodium chloride injection IP, compound sodium chloride injection IP, compound sodium chloride mouthwash BP, sodium lactate injection IP, and sodium chloride tablets BP, that is British Pharmacopoeia, and USP, that is United States Pharmacopoeia. So, these are the official sodium chloride preparations which exist in the market and which we generally administer whenever there is the replenishment of the electrolyte required. So, students, I will just have a brief recap what we studied in today's lecture. This is the potassium ion. Potassium ion exists more in intracellular fluid. So, it is concentration is 23 times higher in the ICF as compared to the ECF. It is helpful in the maintenance of the blood pressure as well as the functioning of the heart in the proper manner. It assists in the nervous system by aiding in the correct functioning of the tissues needed for sending the nerve impulses. It helps in the muscle contraction. Besides, it is also helpful in promoting the efficient cognitive functioning by helping to deliver oxygen to the brain. It maintains the electrolyte balance. Hypokalemia, hyperkalemia, these are the two different conditions where the hypokalemia occurs when vomiting, burns, hemorrhages, diabetic coma occurs when the potassium ion concentration decreases, fine. And hyperkalemia occurs basically in the kidney damage where the calcium or potassium ion concentration is higher and it causes the heart muscle to become flaccid. This is the picture showing the movement of the ion. Sodium ion is coming inside as potassium ion is moving outside. So, this picture shows the action potential whenever there is a muscle contraction. Then calcium ion, besides sodium we did, potassium we did, calcium is the another important ion which is taken up by the food and the rich sources of the calcium ion, milk and milk products, green leafy vegetables. Where it is an important constituent of the teeth and the bones, and hypocalcemia that results from various pathological conditions such as hypoparathyroidism, vitamin D deficiency, bone cancer, hyperactive adrenal cortex, pancreatitis and acute hyperphosphatemia. Chloride ion is another extracellular anion which is taken up from the food and it is completely absorbed from intestinal tract and removed from the blood by the glomerular filtration, and it is responsible for maintaining the acid base balance, excretion of the waste product from the liver. It is an important constituent of HCl in the stomach for the digestion. Chloride deficiency occurs from the diarrhea, vomiting, sweating, and it can lead to metabolic alkalosis. Chronic pyelonephritis is also a condition which lead to chloride deficiency. Then salt losing nephritis, whenever there is an inflammation of kidney, that is related to the chloride deficiency. So, hyperchloremia occurs when the chloride ions are higher side. So, dehydration, decreased renal blood found in the congestive heart failure, severe renal damage, excessive chloride intake lead to hyperchloremia. This is a table which is showing the electrolyte balance which needs to be maintained, the daily recommended dose in the milligrams. Then we need to maintain the balance, otherwise it can lead to different conditions such as convulsion, cramping, fatigue, headache and all. Phosphate is another ion which is the principal anion of the ICF and it is important constituent of ATP. Conditions which are leading to hyperphosphatemia are hypoparathyroidism, whereas hyperparathyroidism lead to hypophosphatemia. Then we did sodium chloride which is taken from the seawater by evaporation. Then sodium chloride essay we did, in which we treated the compound with the excessive silver nitrate and forming of the ferric thiocyanate compound leads to the shows the presence of the sodium chloride. The uses of sodium chloride includes electrolyte replenisher, emetic, anti-inflammatory, as a component of the nasal drop, as a component of the mouthwash, as an irritating agent in the eye drops, and these are the official preparations which are published in the official literature, Indian Pharmacopoeia, British Pharmacopoeia or United States Pharmacopoeia, and this is the official form of the sodium chloride which we take in. So, thank you students.